My name is Jennifer Curtanis, Director of Health for the Farmington Valley Health District, and your host for this segment of Health Matters, a public education TV show produced by the Farmington Valley Health District. Today we're going to be talking about asthma and asthma management. As your local health department, we want to make sure that people are provided the information that they need to live as healthy as they can be. This includes helping people with existing chronic conditions such as asthma. Today, we're very pleased to have Betty Murphy join us today. Welcome,
Hello.
Betty.
Thank you.
Betty is the Putting On Airs coordinator, and she's well versed in the issues around asthma, what asthma is, and what we can do to support people living with asthma. So welcome. Thank you for being here. So let's just start by describing what asthma is.
Okay, asthma is a chronic condition that it can be controlled. It is inflammatory and into the airways, and it causes difficulty in breathing.
Difficulty in breathing. So who is affected by asthma? Can it affect people of all ages?
All ages, all towns, all races. It has no boundaries. Asthma goes where asthma goes.
Yeah, and I know that for children in particular, uncontrolled asthma can result in emergency room visits and hospitalization. So it's really something that we need to work to try and control, because we also know that with the proper medications and knowing what can trigger your asthma, you can in fact live a full life with asthma, but it might take a little bit to really try and balance and find out what it is it takes to manage your asthma.
That's correct. So knowing the correct medications, knowing how to administer them, when to administer them, and also knowing your triggers and how to manage those are very important.
Great. So as a chronic condition, can asthma actually be cured?
It's not cured. However, for some, it does go away for a little while. We find that for mid-age, somewhere 25, 35, when people are at their peak for their airways, for their lungs, it may subside. Or sometimes people think it goes away because they have been removed from the triggers that were aggravating it. Okay. And then once they're reintroduced, then they may flare up again. So the great thing about asthma, I guess, is that even though it can't be cured, you can go for long periods of time, if managed well, without symptoms. Absolutely, and lots of people do that.
Yes. So you mentioned medications earlier, and I know medications are an important part of asthma management, not all of it, and we'll get into that. But can you talk a little bit about the types of medications that people might need to use to manage their asthma symptoms?
Sure. So they fall into a couple of categories. The first is usually considered a controller medication. So for people who have chronic inflammation or chronic swelling, then they would take a daily medication called a corticosteroid. And those they're typically inhaled twice a day, or they're taken through nasal once a day. Okay. So that's called a controller. And then they also have what's referred to as a quick relief, and that is a medication that works very quickly, within 10 to 15 minutes. And what it does is it releases the squeezing around the airway so that you can breathe. So the corticosteroids last about 12 hours, which is why they have you take it twice a day. And then the quick relief works within 10 to 15 minutes.
So if I am someone with asthma and I'm not experiencing symptoms, do I go off my medications, both the controller and any other type of medication?
No, just like any chronic illness, compared to blood pressure or something like that, where once it's controlled, people aren't always, they think it's gone. So, but it's really the medications that are working. As mentioned, with the corticosteroids, it'll take about 2 weeks for them to completely reduce the swelling and the inflammation within the airways, and then it probably probably takes maybe 2 to 3 weeks if you were to stop for it to come back full force. So it's a slow process, but when it comes back with a vengeance.
So the controller med, usually people stay on those consistently. It's a daily medication regardless of symptoms. And then you mentioned the other, did you call it a quick relief? So that's a medication that someone would use when? When they're having difficulty breathing. Okay, so when
they may have had a trigger that that caused their airways to squeeze, and also if someone hadn't been taking their controller medication for a period of time, then they're also having that inflammation, and then the squeezing will just close the whole thing off.
So I've certainly had friends and know people that have had children that have asthma, and they've been on different types of medications. And it always seemed to me that for the kids, it was a little bit tricky for them. You know, you've got this inhaler, you want to draw the medication deep into your lung, requires you to kind of breathe in and push all at the same time. How do we make sure, particularly if we're parents of kids that are newly diagnosed with asthma, that the children are really getting the medication they need into the lungs?
That's a really good question. And what would do that is what's referred to as an Aerochamber or a spacer. And those are recommended for adults as well as children. And what that does is it connects right to this medication. And when you pump into it, it's got a one-way valve. So the medication stays within it while someone is breathing, and it doesn't go away. It doesn't go into your eyes. It doesn't go onto your tongue. And you can just naturally breathe, 6 to 10 times, and it will go into your airway instead of landing on your tongue or going into your throat.
Very good. So we've talked a little bit about triggers. So I guess it's safe to assume that what might cause someone to have an asthma, do we still call them asthma attacks or asthma
exacerbations or flare-ups?
A flare-up. It might be different for different people. So give me some examples of the things that might cause someone to have a flare-up.
Yeah, some of the triggers. So common ones are dust mites, which we all have in our home. And we have them in our bedding. So there are ways to protect against that with non-allergen bedding and dusting, and a vacuum with a HEPA vacuum, so HEPA filter. So then there are also triggers such as upper respiratory infections, very big one. That's probably the most popular because you're also congested, and we often say once the nose goes, then the rest follows. So if you're congested, and then it will already inflammation and plug things up. Other triggers would include pets for people who might be allergic to the pet dander. That's a really tough one. Yeah, because people like pets.
Right, of course.
Yes, and if you're allergic, and there are really no non-allergic dogs as much as people think.
Really?
That.
Okay.
Yes.
So my sister-in-law has what she says is
a non-allergic dog.
Hypoallergenic.
Hyperallergenic. Right, and it's not really, it might be for that type of asthma or for her degree of sensitivity, but everyone has a different level of sensitivity.
Right.
And then the other triggers can be something as exercise-induced. So some people just get their asthma flare up when they're exercising. So they would take their quick relief prior to exercising. So prior to running, prior to gym class, lots of people may see that a lot of children going to get their medication before gym so that they can, and it just opens their airway.
Yeah. So, and then can cold exacerbate asthma as well?
Yeah,
Cold
absolutely.
temperatures?
Yes, cold temperatures, if you're sensitive to that. We recommend a lot that you would just put a scarf over your mouth when you're going outside, just to warm the ear, because it's shocking your airways when you're in the 6 degrees or the wind is blowing.
So at the Farmington Valley Health District are involved in a program called Putting on Airs, which is the program that you coordinate for the greater Hartford area and our health department in particular. And this is a program that's funded, I believe, by the Centers for Disease Control, and resources come through the state health department. Can you talk a little bit about what the Putting on Airs program is, and then we'll get into some of the detail about what it provides?
Sure. So the Putting on Airs program is funded, as you said, through the CDC. It is available to all families in your district, in the greater Hartford area, New Haven County as well. There's in a variety of places. And it has no cost associated, no out-of-pocket cost. The idea being behind it that for families who have a member who has uncontrolled asthma, that the cost associated with the emergency departments and the doctor visits and the missed school and the missed work days is, we're trying to help with that.
So as part of the Putting on Airs program, what does that entail?
Yeah, it entails 3 home visits over the course of 6 months. So with an asthma educator and an environmental specialist. So they will come, the environmental specialist comes once and does the conversation around triggers, and will look for potential triggers within the home and educate on that. And the asthma educator will come 3 times.
Okay, so you mentioned that this was a program available to individuals or families that had someone with uncontrolled asthma. Can you tell us a little bit what you mean by uncontrolled asthma?
Yeah, sure. So that means whether they've had either hospitalizations or emergency department visits, missed school days, missed work days, or if they had sick visits, several sick visits. So they're waking up in the morning and they're not feeling well, and they call their doctor to come in for a visit, or they're using the urgent care centers.
Okay, so the theory behind this is that, yes, asthma can be a complicated illness, but the more you know about what your triggers are, and the better you manage your medications, both the controller meds and the quick relief medications, you really ideally can get to a point where you may be relatively symptom-free. So I guess the idea of bringing a asthma educator and an environmental specialist together really helps connect the dots.
Yes, it does.
And so one focuses on, as you mentioned, the proper use of medications and signs and symptoms, that sort of thing. And then the environmental specialist, can you tell us a little bit more? Do they actually the visit happens in the home? Do they actually go through the home?
Yeah. So they walk through the home with the home, the person who's living there, and we take an assessment first about concerns that they may have. So if they have water damage or water intrusion coming in, or if there is a smell. So there may be a moisture smell, and they may say they don't know where it's coming from, and we may look at that. We'll talk about things like roaches, where some families have where they're have those in the home, or rodents, so a mice infestation, so things like that. So we will work with the homeowner to try to fix that. Yeah.
So do you leave them with some type of a written report, and then you mentioned that there's 3 visits, so I imagine that you continue to revisit some of the action steps that they may have taken?
Exactly. So they do get a written report that has the recommendations and what it was covered on it. And that same report goes over to their clinician, the doctor, because really the doctor or the APRN, who's ever managing their asthma, is that they are actually the ones who are directing us on what to do. So we do not just go in and do the asthma education. We receive the medical orders from the prescriber, which is the person who prescribes and makes the orders those medications, and they tell us what medications they would like that they put their patients on and the way they would like them to take them, and then reinforce what it is that they have prescribed.
Excellent. So I was going to ask you about kind of the linkage with the clinician, the pediatrician, the pulmonologist, because I think, you know, effective chronic disease management really requires, you know, that connectivity. Yes. But asthma, you know, physicians have such little time in the office to really spend time demonstrating how, for instance, a spacer or an Aerochamber is used, or really working with the family to kind of walk through, well, what do you think your triggers are, et cetera. And they certainly can't, you know, be doing home visits to really help see with a fresh set of eyes. So it's great that there's that linkage. Is there outreach to providers in the area so that they're aware of the Putting on Airs program and can refer as well? Or do the referrals all come from a family member or someone with asthma?
Predominantly, they come from the clinicians.
Okay.
So we do quite a bit of outreach with the hospitals. So with UConn Health Center for this area, CCMC, Connecticut Children's Medical Center, they are all very connected to us, and they do a lot of referrals. So because they're seeing the sickest of the sick, so they'll send that over to us. Yeah.
Now, if a family needed, for instance, you talked about dust mite covers for pillows or mattresses, is there any support or resources for folks that might need those types of things?
There are some insurance companies who will cover that, and so what we will do is we will provide it's called the DME, so which is the medical provider, durable medical equipment. We will provide that information to the clinician when we send the disposition letter, and disposition letter being the findings that we found when we were in the home and the recommendations that were made, so that, and one of those might be to initiate what's called a prior authorization through the insurance company, so that the covers would be covered.
Because that could be some of the more frustrating experiences if you identify a trigger and there's a fix for it, and either there aren't the resources available to help a family, and or, I mean, I find, you know, you probably do find situations in which, for instance, a family is not willing to part with a beloved pet.
Yes.
Are there strategies that can be employed, you know, if they want to keep their pet but still want to reduce that trigger for a family member?
Yeah, we do that with most things, is that we provide information on how to avoid them if necessary. So for things such as pets, which are a big thing, so possibly keeping them out of the asthmatic's bedroom. Also washing hands after playing with them, and also, you know, not necessarily, if they go on the furniture, try to keep them on one piece of the furniture, and maybe keep a towel so that it's somewhat contained.
Right.
We would do the same kind of information with cigarette smoking. Lots of people smoke cigarettes, and how do they still manage their asthma to their best of their ability while they're working to reduce smoking.
Yeah, I would imagine that's very, very difficult. And if you have a family member who's a smoker, there are probably strategies that could be used to reduce secondhand smoke in the home.
Yeah. And we try to reduce it to third-hand smoke is the way we're moving.
Yeah. So just switching gears quickly, I know asthma management, you know, requires, you know, everyone, particularly for kids, to kind of be part of the solution. And with kids spending so much time in the school setting, you know, school nurses and faculty of schools, have had to become more aware of asthma and kids carrying medications and the need to access medications during the school year, et cetera. But there's also something called an asthma management plan that can be a really valuable tool to make sure everyone's on the same page. Can you describe a little bit what an asthma management plan is and how it's used?
Sure, and for this area, a lot of times it's actually, people may refer to it or see it as a well sick plan. So it's just so that in case people their clinician might call it a well sick plan.
Okay.
They'll know that that's what we're talking about. Yeah, because they're just terms that different places use and they mean the same thing. Is it will have written instructions on what to do every day. So we call that the green zone. So what you take this medicine at this point every day, no matter what, even when you're feeling well. And then when you start to get symptoms that are showing and there may be a flare-up coming. So we try to nip it in the bud, so as we say, so that when do I start my quick relief? We don't want it to get too far away from us,
Sure.
and then the medication doesn't work, and then the only way to relieve it is through the stronger medications in the hospital. So we're trying to avoid that. And that, so it will go the green zone every day, yellow zone, start cautious, take these. They also refer to it as step up, so the clinician's probably adding a medicine for this sick period. And there'll be a piece that says if you're taking you're on your step up or your yellow zone for 3 days, you should call the doctor. So let's check this out. And what we're trying to do is really avoid those hospitalizations and emergency room visits.
Yeah. And can children of a certain age carry their own medications in the schools now? I think.
Yeah, there's really not an age level. As you know, may say it's really done by ability to manage
maturity of the child.
maturity. Some children at 10 are much more mature than those at 12. And so will do, and that has to be written off by the clinician. So when we get orders to try to get the child to be able to self-administer, then what we will work towards that, and that comes through the clinician, and then typically that the nurse will double check that, so that the child will demonstrate to the clinician, we will teach the child, who will then teach the clinician, and then the child teaches the nurse. And then they sign off on it to show that they can do that, especially if they're into sports.
Yeah, absolutely. So the Putting on Airs program that you mentioned, it's available to people that have uncontrolled asthma. It includes 3 home visits over 6 months. Those home visits really, on the one hand, reiterate and reinforce the medical advice that the clinician has provided and provides additional education, and then the environmental specialist really helps to identify specific triggers and makes recommendations for elimination of those triggers in the home. If someone were interested in taking advantage of that program, how would they go about doing that?
So they can call your office, and your office has direct line to mine, and then we would do that there. One thing I didn't mention that I think is important is that we do home visits 7 days a week, so that we do not ask people to take time off from work or school, and we do work our schedule as best as we can around that. So
Great.
we do have visits on Saturday and Sundays.
Yeah. Well, I think it's a really wonderful resource for people that are maybe newly diagnosed or struggling with the management of their asthma. So I want to just thank you for coming today to talk to us about the asthma program. If you have asthma or have a family member with asthma and would like more information about the Putting on Airs program, please call the Farmington Valley Health District at 860-352-2333 or go to our website at www.fvhd.org. Thank you for watching today, and until next time, remember, your greatest wealth is your health.